Hi, I'm Nancy Brown, Chief Executive Officer of the American Heart Association, and it's such an honor for me to be here today with two amazing volunteers who will soon take over the leadership of the American Heart Association. Dr. John Warner, who will become President of the American Heart Association, and Jim Postl, who will become Chairman of the Board for the next 2 years. And today I want to help our staff and volunteers really learn more about you and your backgrounds and what excites you about the AHA. So, John, maybe I'll start with you. Would you give us a little bit about your background and how you became involved with the AHA?
Sure. Well, it's a pleasure to be here. I'm excited about the presidency year. I'm an interventional cardiologist by training and practiced interventional cardiology for the majority of my professional career until about 5 years ago when I became the CEO of the hospitals at UT Southwestern here in Dallas. And I became involved with the AHA very early on, actually when I was a medical student. I joined the AHA. I worked in the lab of Rosemary Robertson, who actually became the Chief Science and Medical Officer for the AHA. And so from very early on, I had lots of interaction with people that were very involved with the AHA, passionate about the AHA's work. And then along the way, I've become more and more involved as I've grown professionally, and they've been with me every stage of my professional career.
I remember the first time I met you, John, and you mentioned that you had worked in Rosemary's lab, and I called her up. Do you remember John Warner? She said, "Oh, he will be president of the AHA someday." And look at you now. So that's really true.
I don't remember it quite that way, but
she does. She does. Jim, tell us about you, your background.
Well, first of all, thank you for characterizing us as amazing. Both of us, I know, really appreciate that. So I grew up in Winnipeg, Canada, and I still have family in Canada. After the University of Manitoba, I joined Procter & Gamble in their brand management organization, which I did for 8 years. I joined PepsiCo, spent 19 years with PepsiCo. Along the way, I worked in Canada, Guatemala, in charge of Central America. I then joined Nabisco in New Jersey and New York, first as the president of the international business, and then second as the president and COO, and ultimately became the CEO. And it's interesting how I came to be involved with the American Heart Association. It really was through Pennzoil. So, as I mentioned, I joined the company as the chief operating officer, and I arrived and was told that Pennzoil had signed up to be the Heart Walk platform sponsor for the next 3 years. And guess what?
Yes.
I was going to be the chair.
Perfect. Just the way we like it to happen.
So I did that for 3 years and apparently finally got it right. And so they let me do something else, which was join the board of the Houston division. And, you know, the rest is history. And as I think all our folks know, once the needle gets in you, it never comes out.
That's right. And, you know, I think both of you truly symbolize real excellence in volunteerism at every level of the organization. And Jim, maybe I'll come back to you and just ask you to give us a little bit more detail, because you've been involved, obviously in the local Houston division as the chairman of the Southwest Affiliate Board and nationally, with lots of involvement. Maybe you could tell us a little about your progression.
After my 3 years as Heart Walk chair, a group of folks came to see me and asked me if I would consider joining the Houston board. Did a capital campaign to raise money to build a new office, which was very exciting. And from there, I joined the national board for 2 years, and then left for a period of time and came back. At that point, I chaired the Consumer Health and Quality Coordinating Committee for 3 years. I finally learned how to be able to say all those words without tripping. And then I chaired the International Committee.
Well, with all that experience, both in your professional life and with the AHA, we know we're in such good hands.
Thank you.
John, what about your volunteer progression? You mentioned it a little bit. You were involved when you were a fellow, but really you became active in the Dallas division, I think, because of Ron Haddock. Is that right?
That's right. So yes. I moved to Dallas in 2003, and Ron Haddock invited me to a Dallas division board meeting as a guest, and then immediately after asked me to join the board as in true Ron Haddock form. And then I think the next meeting I was designated as president-elect of the board.
Perfect,
so a nice quick progression there. And that was really a very interesting experience for me. That was an interesting time in Dallas. That's when tobacco-free became a very big focus in Dallas. I was part of that initiative, and that was a very good learning experience for me and a chance for me to experience a different side of the advocacy efforts of the AHA. And so I made a lot of great friends on that board, and then moved up to the affiliate board a few years later. Made a lot of great friends. That's where Jim and I met, and got the chance to work together. I was the president of the affiliate board when Jim was the chair. And so that
we get to try it
You
again.
enjoy
That's
it.
right.
Yeah.
So he has no excuses.
The second
He
chance.
knows who I am, and then joined the national board after that, and have been the chair of the advocacy coordinating committee the last 3 years, which has been a very interesting and rewarding role for me. I've learned a lot. I've seen so many different sides of the AHA and the way that we impact policy, that we work to really transform some of the communities that really need our help. And so that's been a very interesting experience. And again, one of the most rewarding things that I've done in the AHA.
Yeah. It's, when I think about both of you, a word comes to mind, and it's architect. If you think about the changes of the AHA, which have been very significant and very exciting in terms of the expansion of the work of the AHA, Jim, you really were there with Ron at the very beginning of expanding our international committee work from a small committee of scientists thinking about how to do great work in international markets to really building with us an entire business infrastructure to support the global expansion of the AHA. And John, you've been there with us as we've really expanded in a drastic way our work in public policy and advocacy. And I think the organization is in a much better place today because of that. So now I want to ask you about the future a little bit. What excites you about the AHA? What are the things you hope to accomplish during your terms? And how can we as staff and volunteers support your vision? John, can I start with you?
Sure. I think this is an amazing time in cardiovascular health because there's a lot of attention on it, and B, the science is really, I think, peaking. There's so many ways that we're impacting the health and well-being of others now, in prevention and the treatment of diseases that, for many people, are considered almost not curable. And so it's really been, it's exciting to be part of that right now. It's really, I think, there's always these sort of steep slopes in time where science really takes off and you really do meaningful things. So being a part of that community, I think is really, it makes it an exciting time to be the AHA president. And as we look forward, I think the focus has to be on advancing science and really thinking about bringing all the resources and impact that the AHA can bring to bear on the scientific community so we can continue to make the strides that we need to make to cure cardiovascular disease. It's also, I think, an interesting time in our country, right?
Yes.
This healthcare reform's no longer just a buzzword. It's something we're living and breathing every single day. And the word reform, I don't think, is a good word for it. I think it's just change. We're beginning to really look at the best way to spend our country's money to advance the health and well-being of all of the people that live here, not only nationally but internationally. So I think it's great to be part of the AHA right now because we're right in the middle of those conversations. We're realizing that all of us has a role to play, and it goes beyond just doing your day job, treating patients, doing science. You actually have to be part of really transforming the communities that we all live in. I think the AHA is well positioned to do that.
Excellent. Jim, what do you think?
Well, let me echo what John said in terms of this being a very, very exciting time to be part of the AHA and to be part of the leadership of the AHA. As I mentioned earlier, I've worked for a lot of great organizations, but I have to tell you that there is more innovation that's going on here at the AHA at this time than I can remember in any of the organizations that I worked with.
That's a big statement.
And led.
Yeah.
And there's just some wonderful things that are going on. We have a very strong base, American Heart Association. We've got a number of actual businesses where we generate surpluses, but very excitingly, the AHA is at the forward point of the curve in terms of One Brave Idea, the Institute for Precision Cardiovascular Medicine, Cardiation Capital, and so on. And so as you think about what is going on, AHA in the next 2 or 3 years will be unrecognizable to those who have been 10 years ago.
Right.
And it's just, it's a terrific opportunity to be able to work with you as we think our way through these things, to work with John. I think we're going to do great things together.
There's no question about it. And I think all of that, is built on this foundation of excellence that the staff and volunteers of the AHA, deliver for this organization every single day. And it's one of the things that all of us value about this organization. It's always mission first. It's always making sure that we are providing equitable health and well-being for every single person in this country. So as we think about expanding globally or launching new science and technology businesses their new and cutting edge ways to help deliver on that same promise. And I think that's the thing that's great about the AHA. And none of it, of course, happens without donors who generously give their time and their resources to the AHA. Both of you are significant donors to the association, and you also help bring other donors into the organization. And if I was going to ask you, what is the word you would give to our staff and volunteers who are listening about the philanthropic future of the AHA and ideas you have about continuing to elevate our game there? I'd love either or both of you to give your thoughts on that.
Well, I hope that we cross the $1 billion mark in my term. And I think that's very doable. As you think of what we've been able to do in terms of courting major donors, over 100 of them are giving six-figure gifts or more.
Just in this fiscal year.
Correct.
Yeah.
I mean, we have donors giving seven-figure gifts. The kinds of things that we are doing with corporations, with Verily, with AstraZeneca and others, that is really driving our ability to drive the mission forward. And so that's what this is all about. I mean, that's why we raised the money. And I think that our folks should have the confidence going forward to continue to push the boundaries.
Perfect. John, anything to add to that?
I totally agree. I think, when we talk to potential donors, people who want to become philanthropically invested in the AHA, I think I always speak to them about impact. All the things that the AHA does have such a huge impact, and even more potential impact sometimes at the time of the ask, because of the partnerships that we have with other nonprofits and with the legislative community, everyone. The AHA is so broadly connected with different attachment points for different groups of stakeholders. And so I think the gift that you make goes beyond just the project that you're giving to, the initiative that you're giving to. It's also helping build those important relationships that the AHA does a great job of leveraging to improve the health of others.
The first major gift begets more.
Absolutely.
And so what it does is it gives the donors an opportunity to really engage in a very intimate way with the American Heart Association, and invariably they come away more passionate and enthusiastic and wanting to do more. And we have seen that over and over and over again.
And I think my very last question for both of you, this week is a great week that embodies all of what's great about the AHA, because in addition to the corporate business of the association, the board meeting and all of our committee meetings, we have a chance to recognize really amazing volunteers for their service. Tell me a little about what this week means to both of you.
I mean, aside from our coronations?
Yeah, exactly. Yes, where the crown is on its way. But beyond that, well,
it's a great opportunity to recognize people who have made a huge difference over time. And the three people that are being recognized as Gold Heart Award winners are unbelievable, and their fingerprints are everywhere, all over the AHA. So it's very exciting, and I'm just very proud to be associated with folks like that.
Yeah, I'm always inspired by this week. The awards and the stories that come with the people that have made these big impacts on the AHA and all the work that the AHA is doing. So I can't wait to hear the sort of the downstream stories around how they got started in science, how they got started in advocacy, all the different things that have meant so much to them about the AHA. I think it's just a great inspirational week. You get to see people you've heard about, grew up learning from and learning with. And so to me, that's a big part of this week, is being inspired to do even greater things.
And I know I speak for all of the staff when I say that what inspires us is the opportunity to work with amazing volunteers every single day. And the two of you, are an inspiration to me and to so many of us. And we really look forward to a great year ahead. Thank you for this time this afternoon. And we'll be watching for amazing things to happen under your leadership.
And thank you.
Thank you.